Some cons of being a forensic nurse are moral distress due to ethical dilemmas that are presented by victims not wishing to report abuse while the nurse wants to function as an advocate for the patient. Another con of being a forensic nurse is the nursing shortage, which is the shortage of bedside nurses. This shortage is due to the shift of forensic nurses towards regulatory agencies from the bedside in their specialty. Another con of being a forensic nurse is the long hours due to on call shifts, nights, weekends, holidays, insufficient relief due to lack of nurses in this specialty field, and oftentimes the supervisor must cover the shifts. Another con of being a forensic nurse is also what can be known as secondary traumatic stress or vicarious trauma. Secondary traumatic stress is also known as compassion fatigue, and the symptoms of that can be anger, fear, nightmares, sadness, helplessness, anxiety, and hypervigilance, meaning that the nurse becomes so overly protective of their family, especially females in their family, because they're worried about victimization for their family members or even worried about victimization for themselves to the point where it makes them very, very anxious and it affects their daily lives. Another issue that is a con of being a forensic nurse is that nurses often worry about their victims and what happens to them after they leave them because there's no specific follow up plan for them. And unfortunately, because of the legal ramifications, the nurses are not able to function as true patient advocates because it presents a legal conflict of interest.